The rhythm of the Rohe. Ngāti Hine FM.
Kia ora koutou katoa. My name is Tamara Birchall. Me te tahe tōna kranipa no te hukutu, no whirinaki, ko te whānau robust me te hira. I te tahe tōna kranipa no kaikohe, ko te whānau pau. I was born and bred in Kaikohe and raised in the far north and schooled in the far north at Okaiho College, and went off and did training with Mataroria.
Kia ora te whānau, ko Mataroria tōku ingoa, hiuri hau no Ngāti Hine te ore wai, ki tau tōku pāpa, ki tau tōku māma, no Ngāti Kahu Whangaroa, no Ngāti Waihoki, me Ngāti Hau Whakapara, Whangaroa, me Whangaruru, no reira kei te mihi atu kia koutou.
We've sort of interacted over the last 2 weeks. It's been really full on the last month, like actuals. So, I felt we'd just have this as a conversation. You're learned people, you are doctors, so we appreciate the expertise that you come into this kōrero in terms of your profession in the health field. But i te tuatahi, what's really been on your guys' minds as doctors? I mean, the latest kōrero is we're coming out of alert level 3, alert level 4 and going into alert level 3. What's on top of your minds as doctors, as whanaunga in COVID-19, the pandemic, i te tuatahi? Any sort of overview on where you are since, when was it? March 25th, since we really got the hit of what's going on in our whenua. Kia ora koutua.
Top of my mind is about keeping people safe, keeping whānau safe, making sure that they're well. But I'm also mindful of the taimaha, the impact that COVID's having, not only in terms of people's health, but also people's lives. Thinking about people where they're staying home, but our queer and our kaumātua who might be in need, thinking about people's welfare and all the mahi that's happening within the iwi, not only from the health perspective, but thinking about the welfare as well, and people who have lost their jobs, people who trying to look after the kids who aren't going to school, all of the big picture stuff that's also happening to our whānau. So while I'm thinking from a doctor perspective around COVID and making sure that we're controlling that and keeping the numbers low, I'm also thinking about everything else that's also happening to our whānau too.
Yeah, I think I absolutely agree with Mataroria, and I think this has been a huge change in everyone's lives, this pandemic coming to our shores, and I just think absolutely there've been people who've lost their jobs, and it's been huge changes in people's whānau, and it's about keeping ourselves safe at the same time, and making sure that we are still reaching out and being supportive and providing the services that we can to our queer and kaumātua, our children, our tamariki. But from a doctor's perspective, it's also about making sure that we are delivering our health services and just letting people know that we're still here to provide a health service to them during this time while we're amongst great change. So yeah, that's been one of my biggest whakāros, is just making sure that we're still delivering and providing services as best as we can and amongst this change.
And I'll just add as well, thinking about our tikanga too and how we are able to have our tikanga happen. Just yesterday we had our first tele Zoom pōwhiri. I don't know what you call that, the zui, the hui and the zui, and how do we continue our tikanga in such a time when our tangihanga processes, our pōwhiri processes, we aren't able to have hariru, and so I'm just there is really the health perspective where we're coming from that's really important at this time, but also mindful of all the change that's happening to us and not being able to grieve our mate within our whānau. And so just have the aroha for whānau out there who are going through that at the moment because of COVID and lost their loved ones.
I think from a health perspective, especially here in a GP realm, we're still going to be doing, limiting our face-to-face contact. And I know it's definitely been a challenge the last 4 weeks during lockdown, but we would be expected to continue that during level 3. It is an odd thing not to interact with your patient and their whānau when they are presenting. And I know that, you know, we're going to have to be looking at continuing or limiting face-to-face consults during alert level 3 as well. So I think that's probably been one of the biggest changes in terms of a GP context. We're probably not seeing as many whānau come through the door as we would like, and a lot of our whānau are still staying at home when they're really unwell. So I think one of the key messages is definitely to say that, you know, if you are unwell and you need help, your GP services are still available. So I think that's going to be a theme in alert level 3, is we're going to be continuing to work virtually and limiting our face-to-face contact with whānau.
Just picking up on your point too, Emma, about I've heard in the news someone said, oh, it's like level 4 but with KFC. So, you know, there are rules around more takeaways being open again. I think that's one thing about level 4 was not having all those takeaways for us to eat, but have to cook our own kai. But there are rules around having takeaways that are open if they're drive-through, or if they're able to be delivered, but not being able to have eat-in options. So a lot of restaurants or things will still be closed, but those takeaways will be reopening again. So hopefully we keep with our kai at home and keep making those homemade burgers rather than McDonald's now that level 3's come. But also picking up on the point about Tamara saying is that, you know, for healthcare, you know, a lot of it is happening online now, virtually over the phone. That's some of the mahi I'm involved in too, around a health service called Tend that I'm developing to have virtual consultations happen, you know, over the phone, through your phone, smartphone, because that's the way that things are happening now more and more, not only for health, but also in the way that people are working too. And so that's one piece of mahi I'm involved in. But picking up on the point around level 4 compared to level 3, it is still really important to stay home. It's not like now we're going back to normal because we've gone to level 3, staying in what, you know, people call it your bubble, keeping those social contacts, distancing, you know, 2 meters when you're at the supermarket. That's still real important. So we're you know, we're not out of the woods yet. We're still under this issue, pressure with having COVID. But I think what you know, Jacinda and them are saying is you can open your bubble a little bit, but it's not the time to have a whānau reunion or having the whole whānau come around for a cup of tea. I know some of my whānau have been trying to come around during COVID lockdown, and I tell them, oh, stay home. And then I kind of shut the curtain so that if they did, you know, like, you know, not supposed to be coming around. And so now with level 3, is that you can visit looking at some of your whānau or caregivers supporting those whānau who are living alone. So there is that chance to open or, you know, have contact with some people, but it's not the time to be having a party yet. Maybe when we get lower down in the levels, we'll be there. But for now, staying home, keeping safe, keeping well, keeping those social distancing still happen. That's still really important for level 3.
If we can hoki whakamuri I te tuatahi, some of, you know, your knowledge around what is a pandemic, that's a big word for me, influenza, and how it all works, this herd mentality, this immunization, these vaccines, when are we going to see a vaccine? But looking back 100 years ago, I'm pretty sure something similar happened. Any lessons from there?
I think from from learning about it, I think it was definitely a part of our training. Definitely public health is important, and you know, I know that we have learned about different pandemics during our medical training, such as, you know, the Spanish flu in the 1800s, 1900s, cholera, the Black Plague as well. I think in terms of the things that we may have learned from it, I mean, we've got public health measures that are, you know, we've got the resources down, we've got the knowledge and the research available around viruses, which we probably didn't have back then. So, you know, we're in a position where we've got, you know, preventable measures and modern technology and a more advanced understanding now of viruses, and public health plays a huge role as part in the medical world, absolutely. So I think we have learnt, and we're definitely in a position where, you know, we wouldn't have the modalities back then that we have now.
I certainly haven't seen this scale before in my own lifetime, but we do know, you know, from our matua that these situations, the influenza pandemics and others that Tamara's said have happened in the past. You know, thinking back even most recently to measles outbreak late last year. So there are different types of outbreaks that happen, and COVID is a big one that's happening right now. But also, you know, we saw SARS and swine flu and others. And we know from the past research that Māori had a huge impact in Māori whānau and Māori health, knowing that Māori were hit harder than non-Māori people. And so those lessons we need to keep learning to make sure that the health services that are being provided are making sure that they're doing a good job for Māori and for whānau. Otherwise, we're still going to be worse off if those services aren't ready and aren't providing good care to Māori. And that's why it's awesome to have the likes of Ngāti Hine Health Trust and our other Māori health providers, Kia ora Ngāti Wai, and others across Te Tai Tokerau that are providing those health services for whānau, Te Haurungapui being another one, to make sure that there's good health care, good health services that are happening for Māori, good planning, good response, because otherwise, like we've seen previously, it's been Māori whānau have been hit the hardest. I've seen an awesome thing on Facebook. You may have seen it on Facebook. It was back from posted a few weeks back from Te Rangi Hiroa, Peter Buck, one of the first Māori doctors, and his guidance that came through possibly around 1924. It's called Mate Refa Uruta, which is the influenza, and his advice. And it's awesome to see, looking back at our history and from our Māori doctors, some of the first Māori doctors, and looking at what they did. It makes me really proud as Māori doctors that there's a real long history of Māori doctors leading the way in these things. And it's interesting too to compare to now. Well, we've got the modern technologies and the new testing and the latest kind of research. Common things that are said, like washing your hands, horo o ringa ringa, noho kainga, those are some of the things that we're still hearing now. So the basic principles of public health, of managing an outbreak or a pandemic, are still the same. We've got more technology, but those things of the lockdown, of staying home, of social distancing, of washing your hands, those are the key things that we can do to try and control outbreaks, control pandemics, whether it's the flu or whether it's COVID. So if you haven't seen that online, I thought that was really awesome to see back from the history books and how other Māori doctors, pioneering Māori doctors have done some of this mahi before us.
The rhythm of the rohe. Ngāti Hine FM.